Would you introduce yourself, please?
My name's Marilyn Freilich.
And?
Peter Freilich.
Peter. Okay, very nice to meet you. And thank you very much for being here today. Marilyn, how were you diagnosed with cancer?
Well, I actually found a lump myself, and then it was the official diagnosis was made through what they call fine needle biopsy, and that was the first I found out about it. Actually, they did fine needle biopsy because of some question in both breasts, and was diagnosed then. But the cancer was actually in my right breast.
Okay. What therapy and what procedures did you do after they gave you that information?
Yeah, I talked with Dr. Farley about this at length, and reluctantly, I went against his wishes, but because he would have really preferred that I not have any conventional treatment. But because I'm a registered nurse and because that's kind of in my line of thinking, I did go ahead and have chemotherapy. Well, I had first surgery, bilateral mastectomy, and then I had radiation and chemotherapy and then radiation.
Did that alleviate the cancer?
Actually, when I can't remember how long after I was diagnosed, that we ran what's called an AMAS test, which stands for anti-malignant antibody of serum. And that was, it was still elevated. And
But she can explain what that is. It's a test that just tells you if you have a cancer going on in your body.
Right, and it was out of normal range, and I did this and then talked to Dr. Farley about it, and he said, you know, Marilyn, you've still got cancer.
How did
So
you
this
feel
was
about
after
that?
she had surgery and some chemo.
And radiation, yes.
Wow.
How did I feel about it?
Yeah.
Well,
What made you choose to go to Lifeone after that?
well, actually, I had talked with Dr. Farley through the process, even though, I mean, we knew each other. And through the whole process, I said, okay, I'm going to have conventional treatment, but I want you to keep me safe through it. So I took all kinds of combination of supplements and different things. Lifeone was not developed yet. Actually, Dr. Farley has said that it's because of my condition that it spurred him on to go ahead and get it developed in the primary stages. So I started. We were talking about this the other day, and I can't quite remember when it was actually developed and when I actually started taking it, but it was after that AMAS test, and then I started taking the Lifeone. At that time, we just called it the formula.
Aww.
And then while after that, and I don't even remember the time limit, a number of months after that, we found a decrease in my AMAS test.
Oh, okay. Because I was going to ask you, how long did you feel that the Lifeone, you felt that it was working?
Well,
But you felt
there
the
again, it was a
difference.
number of months, and it may have been between 3 and 6 months that I had the lowering value in the AMAS test. And I still take Lifeone to this day.
Oh, that's nice. I take it also,
Yeah.
so I understand. What was your biggest wish back then?
Well, to live. I mean, I think
And your
that's,
motivation?
and I think that, you know, to be able to see my grandkids grow up and, you know, enjoy my own 2 daughters and certainly life with my husband. I mean, life. I think on all the things that it offers, and I'm a registered nurse. I think that some type of service has always been on my mind, and that as well.
Well, I'm very happy for you. How long have you been cancer-free?
11 and a half years.
Wow, that's
I
great.
was diagnosed in October of 1999.
Wow.
Yeah,
Have you gotten to see your grandchildren?
Of course.
Very
As
good.
long as I can.
And
They're in
you
North
have